Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. Are you so excited? I'm so excited. I have lots of good questions, so let's get into the questions. All right, number one. I work for a public hospital and I do outpatient charge reconciliation. I am not a certified medical coder, just a secretary. Should I get a certification in order to get a raise? Okay. The answer to this question is twofold, okay? People who do charge reconciliation are essentially, this is my understanding, okay? I could be wrong, okay? And if I'm wrong, let me know. They essentially just input what the provider has selected, whatever E&M level they selected, whatever diagnosis codes they selected, and they put it into a program system, and the system generates whatever it needs to generate to charge this patient, right? So that doesn't necessarily make you a coder. In order to be considered a medical coder, of course, you have to be credentialed. And whether your facility gives you a raise for that or not is entirely up to the facility. I don't know. But if it's something that you're interested in getting into because you're already sort of doing it because you're walking through the process, and that does technically count as experience with coding, okay? It does not mean that you are actually coding and that you understand the fundamentals of coding, that you can get an evaluation in management, or you know how to select evaluation in management, you know how to select the appropriate codes, things like that, diagnosis and procedure. So there's a lot to it than just, I'm a secretary and I input information, okay? So if you want to do it because you're interested in the field and in expanding your professional life, then by all means, go for it. It's like I said, it's going to depend on the facility, whatever facility that you're at. If they're going to give you more money because, you've educated yourself and you're at this next level, it would be very valuable for your facility because then all of a sudden you have somebody that's in there that knows what needs to be there documentation wise and things like that. So it would make you more valuable, yes. Could you jockey for a raise then? It depends. I mean, it depends if they're going to let you have that. But I think it's, if you want to do it, go for it. But it is worth it, I think, especially if you're already doing it. This would be just making you better because then you would really understand what's going on. Okay. Just my thoughts. All right. Next question. Is reconciliation of charges a specialty like oncology be the job of a credentialed coder? Or is it just practice? So sometimes medical coders can be both a coder and a biller. Okay. It depends on what facility they're working in. Sometimes coders are like that. I am not like that. I am just a medical coder. There is another office that takes care of billing. Okay, so while it's good, it would be better if I was more hands-on with the billing side. I do know some things about billing only because I've done research on my own. So because of that, that would be the only thing that I would know. Of course, it's always good to know both sides, what the billers see and what the coders see. So it can be part of it. It's not necessarily part of it though. Sometimes you'll be able to get a job as a coder and you're just a medical coder. So, all right. Next question. Why does AAPC and AHIMA have different requirements for becoming a medical coder? Aren't the tests the same? No, absolutely not. There is a complete difference between the two. They are two completely separate, different identities. They have different criteria for meeting what they have for their credentials. Their credentials are completely different. AHIMA, or the American Health Information Management Association, is the longest running medical coding association in the world. They're very steeped in history, so I would think it would be like, it's natural to have competing associations. So, that's normal. So that's what I would think that answer would be. As far as the tests go, you can get the practice exam books and see the difference between the tests. It's very different. Each association has different criteria, and they have different ways of grading. They have different ways of gauging one's knowledge about medical coding. So if you're curious about what is on each of these tests, you can go to the American Health Information Management Association website or the American Academy of Professional Coders and look at what domains they cover in their tests. So if that will help to answer that question. Okay? And I know there's a lot, before I get to the next question, there is a lot if you are considering being a medical coder and you don't know where to start. I have always said to go to either AHIMA.org, AHIMA.org, or AAPC.com and check out their programs. If you decide to go into a medical coding program, I've been getting so many emails about this. If you decide to go into a program and you don't know if you should go to a trade school or if you should go to college or you should go online, my recommendation would be to go to either association website and go to their online programs. You're literally getting the teaching from the associations that is administering the tests themselves, you know, whether you want to sit for a CCA or a CPCA, either association, they're going to have everything you're going to be able to learn, okay? And so that would be what I would recommend. Some people need to have hands-on experience with a instructor, and here's where it gets tricky. If you go to a trade school, it's not a guarantee that even though they have an instructor, that instructor is going to actually instruct you. I have heard horror stories many times about instructors, and I say instructors in air quotes because sometimes they're literally sitting up there proctoring you with a book, and there's no emphasis on critical thinking. There's no talking about their experience as a medical coder. This happens sometimes, so there's no guarantee on how hands-on the provider. You see where my mind goes? There's no guarantee that the teacher is going to be hands-on, okay? As hands-on as you need them to be. So that's something to think about. And you can ask the trade school if you want to go to a trade school, if you want to go to college. You can ask to talk to the instructor and see and sort of see how they are with you asking questions. I know that you may not know what questions to ask, but at least you can ask like the basic questions. How long have you been a medical coder? How long have you been an instructor? There's a huge difference between somebody who's doing active medical coding versus somebody that is teaching and that's all they've ever done. Because book coding and real world coding, I have said this, and I know you guys are going to get tired of hearing me say it, but it's the truth. Book coding and real world coding is two different things, okay? You have the doctor's colloquialisms that they say, okay? Then you have the book and how it is written formally, all right? So that's why I say it's two different things. Just something to think about. You can ask the instructor how long, what association do they belong to, what is their educational background. You can ask these questions. If you're investing money into that school, oh heck yes, you can ask all the questions you want to. If they don't want to answer your questions, bye-bye. You can go on to the next one, okay? Don't get yourself caught up in some of these horror stories, like some of these people who have gone to these trade schools. Some of them are the accelerated program. Some of them are just, you know, pace yourself at whatever pace that you go. And they did not get all the instruction that they should have gotten, okay? When I went to medical coding school, it was self-pace. And we had somebody that would come in, he was a coder, and he would speak about, you know, different topics and things like that. But it wasn't like an active teaching thing that I would consider a teaching thing. I think what I do on my channel would be considered more of teaching than what I got when I was in school, okay? Which is part of the reason that I do these videos, the way that I do them, the way that I structure them, okay? Some people don't like my approach, and there's nothing I can do about that. All I can do is try to be the best at explaining things and hoping that people can understand that it's a lot into this. Sometimes they don't know. They don't know, and they end up in over their head. They feel like I've gotten many of those emails, and here lately, they're like, I'm in over my head. I don't know what I'm doing. And it's natural and it's normal, especially in the beginning. Think about it. We're medical coders. We learn almost everything like a doctor, but many of us just have high school diplomas or GEDs. We haven't been to college. There's a good amount of us that haven't been to college. And so think about that. You have somebody that, okay, you need to learn to be able to communicate with somebody who has an education level like way up here, who's gone to years of school, and you've got to be able to communicate with them and really kind of understand and know what they're saying. Yes, it does get a little nerve-wracking, but a little studying, you'll be okay. And just taking it one step at a time, you'll be all right. The more you invest time and energy into learning and expanding your brain, the better off you'll be, okay? But these things take time, so don't get overwhelmed. I always say that, don't get overwhelmed. But it's just something that you should think about, okay? So again, if you're going to go to a trade school, interview the heck out of them. And then make sure you check with the Better Business Bureau to see if there's any complaints against them. Now, it may just be just the business side of the house, but at least you can sort of get an understanding. And one other thing before I wrap up that one, because I could go on about trade schools. See if you can talk to a former student from the school and see what their experience was like. See how they are in the real world, okay? And if you can talk to the students there, see how hands-on the instructor is, okay? Because if the instructor is not so hands-on, then you're better off doing it at home, okay? Because you can go to either association website and go through their programs for a fraction of the cost that it would be to go to a trade school. I'm just saying. Okay, next one. Talk about the CCS, CCSP, CCA, CPCA versus the CBCS. Okay, this is another one. CBCS, Certified Billing and Coding Specialist. I think that's what it's called. This program, from what I understand, again, I could be wrong, okay? And just let me know, okay? But from what I have read about the CBCS, it is just for billing. They essentially are going to be the billers. You don't have to be certified to be a medical biller. There are many people who just literally walk in off the street and apply with these medical billing companies and they get hired. Okay, so you don't have to go to school. You don't have to have formal training, all right? I don't understand what this program is or where it came from. It's relatively new sounding to me. But again, I could be wrong. But this CBCS does not translate into a medical coding credential. When they're looking for medical coding credentials, they are looking for CCS, CCSP, CCA, or CPC, or CPCA. Okay, that's what they're looking for. And then, of course, there's all these other specialties. But those are the main ones that, you're a medical coder and you're getting in, okay? So there are different programs to go in for all of those, for each one of them, okay? The CCA and the CPCA are the beginning ones where you have no other experience previously and you're taking the test and, you get credentialed. That's something that's different. So CBCS, it does not translate to that, okay? There's no translation there. So if you have it, you can put it on your resume, but if you're looking to get a medical coding position, that CBCS is not going to help you, okay? It's only for billing. And like I said, you don't even have to be certified to be a medical biller, okay? So next question. How many cases need to be coded to be considered 1 year of experience? It's not measured in cases. It is measured actually in time. How long were you at your previous place, or how long have you been in the medical coding field? That's how it's measured. It's not measured by like individual cases. Okay, like if you coded 100 cases and you have 1 year of experience, it's not like that. Because every place is different. Every setting is different. Every setting has different requirements. Okay, so AHIMA has a thing called VLab. You can check it out on the website. And AAPC has Practicode, which I think they say that they use that to remove the A from the CPC. So, I mean, those are ways of, working through. It's not giving you experience, okay, but it is, I guess, helping you to practice and be more confident when it comes to coding. Other than the Practicode is to remove that apprentice from the CPC. So if you're going that way, because I think the other thing you can do is have like a certain amount of experience and they'll remove the A as well. So I don't know if you have to do Practicode. I don't know. But something to ask if you are considering the AAPC program, okay? Their CPCA or CPC program, okay? The next one is, what are my thoughts on Penn Foster? So a lot of people ask me about Penn Foster. I have not been through that program, so I wouldn't be able to tell you like oh yes, it's this or that. What I can tell you, again, like I can reiterate, is if you go through ahima.org or aapc.com, both of them have online programs that are a fraction of the cost. Just saying. Okay. Next one is there math in medical coding? No, there's no math. That's in software coding. That's not medical coding. Medical coding is all anatomy, physiology, medical terminology. That's us. We don't do math, okay? And the other one is difficulty. What does it say? I can't even read my own writing. Oh, difficulty level stopping before you start. Okay. That's what I wrote down. Some people are really interested and very gung-ho about starting medical coding, and then all of a sudden they say that they view my videos and they say, oh, I think it's too hard for me and I'm not going to do it. Okay. You obviously looked at it because you want to do something different with your life. Maybe you didn't know it was quite as much as all of this. I'm very detailed, and I don't want to say guilty, but I guess I am guilty. I am guilty of being very detailed, and I go above and beyond than most people, and even in my facility, most coders in my facility, okay? I go above and beyond. To me, I'm not just there to collect a check. And there's a lot of people out there that are like that. And there's a lot of people that are dedicated as well. So I always want to try to tell people as much as I can so that way everybody knows and they're prepared. And just because things are always done a certain way does not mean that that is correct, okay? And that's the thing I always kind of want to pass on as well, that people understand that they can stand out. It's okay to stand out if you are a medical coder because you're studying and you're helping your facility, your providers to get all the credit that they deserve. It is about digging. It is about trying to make sure that you're looking at this documentation and understanding it well to see if there's anything that's missing, okay? Those are the things that we do. A good medical coder will be able to do that. And so just like doctors, just like nurses, just like LVNs and anybody else in the medical profession, you're going to have your really good ones and then you're going to have your regular ones, okay? You always want to shoot to be really good at what you do because not all coders are created equally. I say this all the time, okay? Because you've got to learn when you're in this, the best and easiest way to enjoy this field is to really dig into what you're doing. You know, this is not one of those things where you can just hit, oh yeah, enter, enter, enter. Everything we do affects a slew of people. It affects the provider. It affects the hospital. It affects the patients. Most of all, it affects the patients. If you're selecting the wrong procedure code, the patient can get charged way more than they need to, or they can get charged way less, and the provider ends up losing. And there is no, oh, it balances out, it evens out. if you hear that, that's garbage. I mean, I'm just going to be honest with you. It is garbage. If you hear that, oh, it'll even itself out. No. Everybody needs to be paid equally as far as like equal for their work. Okay. They need to be paid appropriately is what I mean. Not equal. Appropriately for their work. If they're doing something that is more labor intensive as far as like mental work or physical, then they should be compensated appropriately, depending on what procedure is being performed. Okay, and that's why all of this stuff has to be documented as well, because you never know if something's not documented. Of course, it didn't happen, but then if the provider is looking back at his own documentation and sees something that he didn't do, and all of a sudden he does it again, think about that. You know, it could have a potential impact on the patient, you know, physically or, you know, financially, you know, just something to think about. Okay. So, those were the questions, but I also want to address another thing. I'm still getting complaints about the commercials. Guys, there's nothing I can do about the commercials. My channel is growing. Thank you. I am so glad it is, because this means I'm touching much more people. But with that comes ads. YouTube is a free site. I've given you the alternatives. Subscribe to YouTube Premium for $11.99 a month. You can do the YouTube audio for $9.99 a month, or you can join me on Patreon for $1 at least. You know, that's the bare minimum pledge. Okay, as you go up, there's going to be more levels and more layers of things, and of course, you're actually paying for my time. I do have tutoring sessions built into some of those packages, and they're quite reasonable. So, I mean, that's, you know what I mean? There's nothing that I can do about the ads, you know, and if it really upsets you, you don't have to watch me. You know, I mean, I would hate to lose a viewer because of an ad, but YouTube is a free website. So think about that, you know, and I always try to give you guys quality content. I always try to make sure that what I'm telling you guys is going to be helpful for you in your workplace, in your study time, and any of that. Okay, so that's all I can do, and that's all I can say. So if, like I said, there's nothing I can do if it's really upsetting for you, other than I gave you those alternatives. So, all right. So I'm gonna go ahead and close this one up. But tomorrow we're gonna be talking about Munchausen's. And I have not forgotten. I'm going to be doing a demonstration for the book, how to look up the diagnosis and how to look up procedures. So be on the lookout for those. Tomorrow I will be on time, okay? Today was the Mondayest Tuesday ever, okay? And I keep getting thrown off too with the days. Anyway, I will go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. Okay, I will see y'all on the next video. Bye.